Good evening, everybody. I'm Reverend Liz Walker. I'm pastor of Roxbury Presbyterian Church. I'm the ad hoc executive director of the Cory Program for Post-Traumatic Healing. And we welcome you as you are all coming in onto this Zoom conversation. We welcome you to Trauma, Trust, and Truth, the second edition of our ongoing series, Coping in the Next Season of COVID-19. Joining me tonight, my partner on this information quest, Reverend Dr. Gloria White-Hammond. Gloria is the co-pastor of Bethel AME Church. She is a resident scholar for the Harvard Divinity School. She is, of course, a pediatrician and a member of the Mayor's Task Force on Healthcare Equity. Our special guest tonight is U.S. Representative Ayanna Pressley from the Commonwealth's 7th Congressional District. So I want to thank you both for joining me tonight. It is exciting to have you here. You know, I think that I've heard we're going to have, and Reverend Gloria, you can correct me if I'm wrong, at least 70% of the population has got to take the vaccine before that herd immunity can kick in from that. Is that correct? Are those the figures that you've heard?
Yes, those are the numbers that we've heard. Dr. Fauci referenced a blanket of protection over community to prevent the ongoing spread. And yes, that number is 70. I've sometimes heard 75%, but that's the
Yeah.
I actually had an opportunity to look at the survey, the Vaccine Watch of the Kaiser Family Foundation today. And for African Americans, when it was last taken in September, the numbers were around 50%. Now it's up to 62% among African Americans, up to 71% among whites. So the numbers are moving in what I would think is a good direction.
What I would think it is a good direction as well. We're going to discuss this COVID pandemic and the vaccine tonight in the context of trauma. We define trauma as an event or series of events or circumstances experienced as physically or emotionally harmful with lasting adverse effect. And that adverse effect could be psychological, it could be emotional, it could be spiritual or social. Sadly, trauma is a reality in so many Black lives. And that's why the Cory Johnson Program for Post-Traumatic Healing was created. And there's great trauma around this pandemic. I think the whole world is traumatized in many ways. And a lot of that is about the safety and efficacy of the vaccine, even though the numbers seem to be getting a little better. But there are still people who don't trust this vaccine. And this distrust didn't just begin with COVID. So that's what we're going to be talking about, trust and trauma, how you feel about it. We're going to try to trace the history of that in the African American community. And if you have questions tonight, please put them in the Q&A section at the bottom of your screen. Tonight, we're going to focus again on trust and trauma. You may have other questions, but that's where our focus will be. And because of the large number of people who are on this call, we may not get to all of those questions, but here's what we're going to do for you. If you would leave your email address with your question, we will try to find the answer. We are going to try to be a resource for our community. So we will go to hospitals, we will go to epidemiologists, we will go to whoever it takes to get your answer and try to get that back to you as soon as possible. That's my promise to you that we're going to try to keep. Also, I want you to stay in touch with me, and you can always reach me on Twitter or Instagram. On Twitter, it's @LizWalker1, and on Instagram, you can find me at Pastor Liz. Twitter @LizWalker1, and that's with two Z's, @LizWalker1 and at Pastor Liz on Instagram. This event is being recorded and we'll try to make it available to everyone. So here's my question for you, Gloria. First of all, you brought some data with you that talks about this notion of trust and pain. Let's put up that first slide. Tell us a little bit about this data. This is from the Kaiser Family Foundation?
That's right, the Kaiser Family Foundation and a group called Undefeated, and they have been looking at attitudes around race and health in America. So this first slide is one where they asked Black adults how they feel about being Black in America. Is this a bad time to be Black in America? They compared the findings from for Black men, 2006 versus 2020. In 2006, 28% of Black men said, yeah, it's a bad time to be Black in America. In 2020, that number is up to 65. And with regard to African-American women, in 2011, 15% said it's a bad time to be a Black woman in America. That number is up to 59% now. And I've certainly had the sense that people have felt that way, but I will say to see these numbers was very stark.
Well, let's talk a little bit more about that before we put up the second slide. You know, the whole American narrative is that things just keep getting better. That's the American dream, that progress. We're a country of, you know, where you start here and you move up there. But that's not the reality. That's not the truth, at least in the perspective of Black people. Were you surprised at all?
No, I certainly haven't been surprised, but we anticipate that things will get better. And in fact, the perception is that things have not. And again, I think especially in the context of COVID now with all that's going on.
I believe that Congresswoman Pressley is with us now. I can't see you, Ayanna, forgive me, but we are honored to have you here tonight, my queen. How are you?
Well, back at you. Wonderful to sit at this virtual table with you two queens, and thank you for doing the work every day of the liberation of all people, but especially Black folk, and just grateful for your expertise, for your laboring in love, and for this really critically important work that you're doing in this moment. So.
Well, right back at you. We just showed a slide that Gloria was explaining from the Kaiser Family Foundation that showed Black men and women saying that it's a bad time to be Black in America, and this feeling is increasing over the years. You've seen, I think, that poll, because I think we sent it to your office. But if you haven't seen it, you certainly know the narrative. Is that a surprise to you that it's just getting worse for us, or the perception that it's getting worse?
No, both the perception and the experience are consistent. I mean, it's sobering confirmation of what we have experienced as Black women, certainly, and the three of us, and what I've heard consistently, you know, from my constituents. So I do want to say that, you know, language matters. And so previously I had been speaking about the legacy of policy violence and specifically medical apartheid in this country, and that impact on Black Americans, on Indigenous people, on Guatemalans. But I'm intentionally changing my language from the Black community's trust in the medical community to the trust that the medical community has violated. Mm-hmm. And I think that is an important switch to make, because the onus is really on the medical community to get this right. And that's exactly why I have been pushing for equity-focused policy, an equitable response, for equitable data collection on race, which again has just only bore out what we would have assumed, which is that we would have the highest rates of infection, hospitalization, and fatality. And that has everything to do with the comorbidities of structural racism, unequal access to healthcare. There's hardly any health issue in which Black folks don't have worse outcomes. Mm-hmm. So, you know, oral health, maternal health, diabetes, peripheral vascular and heart disease, the list is long and it's damning. And it's actually why I've introduced legislation in the long term with Congresswoman Barbara Lee and Senator Warren, the Anti-Racism in Public Health Act. Just really to acknowledge the ways in which racism has been so embedded in our healthcare system, but also that racism is a public health crisis. So when you see that this is the coronavirus is the third leading cause of death for Black Americans. And moreover, police brutality is the sixth leading cause of death amongst Black men. So, you know, racism in all of its iterations and forms and how it shows up, which has mostly been through policy violence, it's a crisis. And so the data is just, you know, devastating confirmation of that, which we already know to be true.
Tell me a little bit about policy violence. Explain that a little bit, flesh that out a little bit more for me.
Yeah, I mean, you know, for me, here's the thing, is the harm. the inequities and disparities and the racial injustices, these statistics that we're often elevating, these experiences that we amplify in community every day, they're not naturally occurring. These are these inequities and disparities, this racial injustice, this hurt and harm that has been foisted onto Black Americans was very precise. It was legislated. It was not naturally occurring. And so that's why I consider it to be policy violence. Mm-hmm. And so when we talk about being actively anti-racist and dismantling systems, if we talk about sort of seeing prejudice and racism as some sort of conflated part of our experience as Black folks is like, well, it's just culture. But culture is human behavior. And human behavior is incentivized and is given permission structure through policy. And so that's everything from discriminatory, lending, the practices of redlining, unequal access to the GI Bill. It's so baked into the DNA of how we exist that we have to be actively anti-racist. We have to reverse the hurt of policies that have been anti-Black. And so, I'm operating from a place of, if the harm has been very precise, then the healing must be just as precise. And that is the way that I seek to legislate. If we can legislate hurt and harm, then we can legislate equity, healing, and justice.
Let's bring that to the ground with you, Reverend Gloria. So Ayanna speaks from the policy standpoint. How does that manifest itself with patients who walk into a hospital or a doctor's office, a woman comes in? Tell me the scenario, how that works itself out, if you will, Reverend Gloria.
It starts from the moment that I make the decision to leave the house, right? And how much that I have to go through just to get to the healthcare facility. When I walk into the healthcare facility, the receptionist seems not to notice me, the white person who comes after me seems to be noticed sooner than I'm noticed. Then there's a difference in attitude when I go to register, and then how quickly I'm seen once I actually get up to the floor. The extent to which it seems, whether the provider seems like they believe me when I report my symptoms, how quickly they are to respond to my needs and whether or not I get certain medications. So all along the experience, it's documented that it's more difficult for African Americans, people of color in general, to get the quality care that perhaps that a white person might get.
Absolutely. If you all don't mind, I'm going to call in Colleen Sharka. Colleen is a licensed social worker, and she's also the director of the Cory Johnson program. And Colleen, our neighbors tell us the things that Ayanna is talking about from a policy standpoint, and Reverend Gloria is talking about kind of in manifesting in real. We deal with that every week. Why don't you tell us a little bit about what people are telling you?
Yes, we do. And first, let me just say hello to Congressman Pressley. It's lovely to see you again.
Good to see you too.
Yes. So it is exactly what we find happens. And as Reverend Gloria just really outlined so well, sadly, of the experience that we have witnessed so many of our neighbors go through who come to the program, coming to the Cory Johnson program as a community trauma healing experience, they will then find their way to talk with us about what their experiences are in trying to get some kind of medical care or mental health care. And so what we started doing from the beginning of the program 6 years ago is offering that walking with people, literally being willing to go to the appointments with them and to assist in any way we can. And from the beginning, I've witnessed exactly what Reverend Gloria has talked about. And then what I think I see often when I get into the medical examining room with them, what happens is the symptoms that folks will talk about are never looked through the lens of trauma, and are certainly never looked at through racial trauma and historical trauma. And so a lot of times what will happen is the medical symptoms that are just absolutely ravaging somebody will be more like a blame. Like, you're just not taking care of yourself. You're just not doing this. You're not being compliant. I love that lovely word that gets used. And so what ends up happening is when that's misdiagnosed often, people get more frustrated, right? And feel more like it's their fault there's like a self-blame that goes on. And then of course, when they go home, they're less likely to take the medication or less likely to trust that that's going to be helpful. And then again, we go back to the doctor's appointment the next time and similar things happen. So I've witnessed it many times.
It's horrendous. And here's what bothers me. Ayanna, Congresswoman, I don't see a remedy. Are you optimistic that there is something we can be done that would filter down to that patient who is walking in anytime in my lifetime?
I am, because, we are in the midst of a reckoning, and as Reverend Barber, and so, what is a reckoning? It is quite literally something biblical of epic proportion, right? It's this confronting, this awakening. And Reverend Barber, talks about that reckoning demanding of us a reconstruction. So I do believe we're entering into a third reconstruction, where we sort of radically reimagine everything. And so, for me, this would be passing legislation like our Anti-Racism in Public Health Act, to our Healthy Mommies Bill to combat the Black maternal mortality crisis, to the scenario that the doctor spoke to. I'm struggling here because I want to call all of you by your first names, but I'm trying to.
I know, and
I'm like, pass the glow. What can I say? What's allowable? Because listen. They just tried to, take away Dr. Biden's, title here. So I want to look. You guys have put in that labor, so I want to get it right here. But my point is, when in the scenario that she was offering there about. And that Colleen was offering as well, that the patient presents with a symptom and it is discredited. The pain of Black women has been delegitimized, for so long. So I'm saying that within the context of the Black maternal mortality crisis. So my answer is yes, I feel hopeful. We're entering into a third reconstruction. We're in the midst of a reckoning on these issues. People get that racism is something that is systemic, that it is structural. We have to actively dismantle it. And so that is for me, everything from greater investment in our community health centers, of which I boast a density of more CHCs than any other congressional district in the country. I have 15 of them. 1 in 3 of my constituents receive their care from a community health center. And we know that they have a workforce. They have healthcare professionals that are reflective of the community. So they support and foster that trust because they are reflective. They have that relationship. And again, like I said, it's, passing bills like our Anti-Racism in Public Health Act and our Healthy Mommies Act to combat the Black maternal mortality crisis. So I think we can take care of it all from an infrastructure standpoint, workforce, policy, response. It just has to be coordinated and robust.
Okay. Reverend Gloria, do you share that optimism?
Oh, absolutely, I do. I've been around the planet a lot longer than you have, Ayanna, and I've never been more optimistic, certainly because of people like Ayanna, Congresswoman Ayanna Pressley, who is well in place. I'm inspired by the leadership that I've seen among our younger leaders who are talking about Black Lives Matter. But I'm also encouraged by individuals who are looking at themselves. One of the things that I often take note of is on the same day that George Floyd died, we saw that video in the evening. In the morning, there was the Amy Cooper incident. So that I'm seeing more people who are looking at themselves and the extent to which we are also informed by our isms and examining themselves. And I'm optimistic that we can create a culture that both identifies that and holds each other accountable around making those critical changes to address implicit biases. Good.
But optimistic. I think what happens to me, I'm optimistic. My faith makes me an optimist. But I think that because I've been around long enough to have seen this. Now we've never had a pandemic in my history, but we have been around this block before on issues of justice and on issues of equity. And it always seems so promising. And then people jump on and we're all talking about it and corporations vow to change the thing and then there you go. So what
Yeah.
makes this different this time?
It feels different to me. Look, I've been reading a lot of Baldwin, and that's been a balm for me, during these unprecedented times. And he says that not everything that is faced can be changed, but nothing can be changed until it is faced. And I do feel that there is a more acute confrontation that is happening. And it is my hope, and with the sustainability of this movement, that when we talk about recovery, whether it's the public health recovery and a just recovery when it comes to our public health response and an economic recovery from this pandemic, but that we are not recovering to an unjust status quo pre-COVID normal. That has to be the push here. The recovery cannot be to level set to where we were pre-COVID. Right. Again, this has got to be about that radical reimagining, about that reconstruction. And I don't want to give short shrift to the power of the seat that I worked so hard to, and that y'all prayed and labored for me to sit in. But coming from an activist tradition of a household and growing up in movement building, I do believe that the power of the people has always been greater than the people in power. Every time that we have seen transformative change, it has come from movement building. There would not be Medicare, there would not be a Voting Rights Act, there would not be a Civil Rights Act, there would not still be an Affordable Care Act. We would not be having a national discussion about everything from canceling student debt to combating environmental injustice to confronting dismantling mass incarceration and accountability for police brutality, were it not for the movement. So, the movement is going, we have to do the work of supporting that movement and making sure that it is, it's a vigilant one. So I hear you, Reverend Liz. Look, I won't pretend I don't have my moments where I'm tempted, but I'll say I'm encouraged. I'm encouraged in this moment.
I'm going to take this tape from this program and just carry it around with me so I can listen to your voice in my head. And I think I'm encouraged. I think part of what does give me hope is that there's so many people engaged in this, that this is not just an African-American struggle. It's not just one generation struggle. It seems like there are many people who are, from all over the world who are, or are our allies, accomplices, if you will. So I'm seeking for hope. Some days are better than others. Let's go one step further here. One of the things that really concerns us at our program is the mental health of our country right now. Because, this is a pretty intense moment. Things are going to get better. We're all optimistic. But in the meantime, we are all struggling. What kind of policy, what kind of thoughts do you have? And I'll start with you, Congresswoman, but then I want everybody to kind of maybe speak up on this. What's going to take to heal this country, first of all, to heal the polarizing kind of contentious kind of atmosphere we're in right now? Because as optimistic as we are, this is a 50-50 split. We got people who are just like us in optimism. We got the whole other half of the country that's ready to fight. So what do we do with that? Do we just move past that and not worry about it, Congresswoman, or what?
Well, when you're speaking to the polarization, I don't know if you mean political polarization.
I mean
the reference. Yeah.
Because the country was, we had 80, the president-elect got.
Right, so 73 million people voted for Donald Trump.
Correct, that's all I'm trying to say. You said it very clearly.
73. So look, I think that, two things can be true. And I think, we're being asked to hold space for multiple things right now. So it is true that 73 million people in the midst of a pandemic that I believe this administration operated with willful criminality and allowing to rage and robbing us of, 300,000 American lives, their fellow citizens. 73 million people voted to maintain that very cruel, callous, damning keep a hold on that. And at the same time, the most marginalized came together in a movement that met the moment and made it possible for democracy to breathe another day. You know, you would not have the victory in Georgia without Atlanta. You would not have the victory in Pennsylvania without Philadelphia. You would not have a victory in Wisconsin without Detroit. You would not have the victory, in Wisconsin without Milwaukee, right? And so the most marginalized of Black, Brown, Indigenous, AAPI, young, disabled people came together in a movement. The movement met the moment. Democracy was allowed to breathe another day. We are turning a page on a dark chapter in our history. And so for me, we have a mandate, and it's incumbent upon us to now advance bold progressive policies that meet the needs of the most marginalized. So when people ask me about, look, only the pundits ask me about what is the bipartisan appetite. The people that are calling my office that are in distress, they don't care about that. They just want to know, what are you going to do to mitigate my hurt? What are you going to do to get relief to me? What are you going to do to make my life better? In the midst of not knowing how I can pay for food, for insulin, for an inhaler, to remain housed. If we don't, so for me, Reverend Liz, I get the pragmatics and the mechanics of why people ask about bipartisanship, but that is a talking point. The goal is justice, and the ultimate persuasion tool is impact. So that's what I'm focused on. Policy that's going to, by supporting the most marginalized and giving us, justice, that will bring other people along.
I hear what you're saying, Reverend Gloria. What I believe, and I'm going to bring you in on this, is as a church, as a preacher, part of my job is reconciliation. Yeah. Part of my job is to bring people together. That's just my call, just like yours is justice. Mine is justice too, but from a different perspective. So I'm going to always talk about how can we just get along, Rodney King. And Gloria, do you see any possibility of that? Ayanna speaks of, justice first, and that's true. But do you think we have any responsibility to try to bring people together?
Oh, absolutely, I do. And I know Congressman Ayanna recognizes this as well, that it's not just the policy in the context of the public. There's also the work of reconciliation in the context of the personal. And the people that we see every day, and really starting to create spaces to have those hard conversations. And this is the part that will not be easy, but it has to begin with the recognition that we've at least got to figure out how to coexist in the same space and to begin talking. And what people have found over and over again is at the point that people start interacting with each other and looking to find that common ground, that it is not easy work, but it is critical work, and we begin to move forward.
And I just want to say, I'm not in any way, I want to make this very clear. What I'm saying, Reverend Liz, is that if we're all existing in an ecosystem whereby everyone is doing more than surviving, but they are thriving, then that is unity.
Absolutely.
That is peace. We're operating from a defensive stance and a scarcity mindset. So a lot of that fear of change is coming from a place of loss. And that's from a scarcity mindset. So what I'm saying is that, there actually is enough. That, budgets are a statement of our values. And this is the moment to affirm what we value. And when we are, creating communities that are healthier and safer, everyone benefits from that. And so, but how can you operate from a place of unity and peace when you are under constant duress? When you have been drinking from a fire hose the last 4 years of insult and assault? That's what feeds these unjust binary choices in our budgets and false binary choices, might I add, that really feed that idea of scarcity. So everything feels like someone is coming to take something from you.
Right.
And that's what, so I'm all for unity. I just believe the way to realize unity is to create environments where everyone can thrive and coexist peacefully.
I think you made that clear. I think there's not either or here, there's both and.
Yes.
Colleen, if you're still with us.
Yeah,
when
no,
we
definitely.
when we have our meetings on Thursday evenings, one of the things that we now are discussing is race.
Yes.
And these are, Gloria mentioned this, and please forgive me, I'm just gonna have to call y'all's buddy.
Yeah, please.
I got to get back.
That's right.
We're around the kitchen table.
But these are tough conversations that are going on. Colleen, I'm going to let you kind of share a little bit about it because you're right there every week and I'm not. What kind of things are being said in our racial trauma evenings?
I think the first thing to bring in is what you and I were talking about, Liz, all week long, and that is betrayal. And it's what Ayanna was saying about the trust the medical community has violated. Like, we need to recognize that, but that every single trauma that we're talking about here has been a betrayal of some kind. And so it doesn't necessarily mean it's just somebody you knew, but when it's the community, when it's the world at large, we are actually already one. We just forget that, right? So it's a total betrayal. And I think that understanding the need then to share your stories around that, which is what we're really doing by providing this both when we were in person meeting in the church and online each week. That's what we're hearing, particularly around the talks on racism, about trauma and racism, and understanding those go hand in hand, so sadly. And so people have to talk about that betrayal. And one of our team members, Doug, talks about all the time, what is it that I ever did? Why? Is there a reason that when I walk down the street, you're gonna force me to move away from you and you won't, if I'm walking in a straight line? Or that you'll, follow me in a store, or that you'll not do the same service at the medical provider. I mean, it's just, we're constantly hearing that sense of pain and loss around the betrayal of human to human. And I love that term, medical apartheid, that you said, Ayanna. That is exactly what people are really talking about on a day-to-day basis. So the ability to tell your story, share about the loss, and then, of course, what we start to hear about is the hope and the healing as well.
But we've got to, before we can get to the hope and the healing,
Yep.
we've got to confront the reality of the pain. I was hoping that we could get personal because I think that's how we model what has to happen. And if you, my friends, my sisters, don't mind, I thought maybe I could just ask each of you about your own pain and your own trauma. Let me just tell you my little story, and I'll make it as quickly, I'll say it as quickly as I can. I grew up in the South, in Little Rock, Arkansas, and I grew up during the time of school desegregation back in the 50s and the 60s. When I was in the first grade, Little Rock Central High School was being desegregated, and Dr. King, Martin Luther King, came through Little Rock, and so there was this, I just remember just a lot going on in my little eyes. But I also remember being a part of that desegregation later in junior high and high school. And I remember being spit upon, and I remember being called out of my name, and I remember just having to fight. That everybody, you went to school, you had to fight. Now that was 1963, 64, whatever, and I'm still dealing with that. I have yet to work that out in my head. I don't go back to Little Rock. I have issues that Colleen and I discuss about it. To me, the idea of the depth of the pain is what I think people miss if they haven't been through the experience. So we can talk about it at all the different levels, but ultimately it goes down to the heart, where you are in your heart. When Ayanna said that this is, it's kind of like blatantly purposeful. Well, this is my interpretation of what you said. What's been happening, it wasn't just happenstance, it wasn't just random. That's how it feels. You feel like you've been beaten up all of your life and you can't get rid of the anger and you can't get rid of the pain. My question to all three of you is, have you had any experiences like that? Now, Colleen, I'm not trying to put you on the spot, but is that simply me? Gloria, do you have any kind of racial things that you bring with you, or from any area?
I can remember when I was in the 8th grade, and I won. I was in a spelling bee in New Hampshire, and the prizes were the top 2 prize winners would get a trip to DC to to have a tour. The third person was going to get a set of books. And I missed my word, so I came in second place. I'm the only Black kid in the whole school, probably, lots of, and they, after the contest on the Saturday, on Monday, the teacher called me to her office and said that she wanted to suggest that I not take the trip to DC, but instead take the third prize, which was the books. And her justification was that the third place winner was blind, and it would be generous of me to give up my trip so that he could have the trip to DC. And I knew that it was because I was Black. And to this day, when I think about touring DC, where you are, Congressman Ayanna, I remember that incident. And the word that I missed, that I spelled incorrectly, was dilemma. And that is with me to this day. Just one of the things, right, that I remember.
Ayanna?
I think there's too many instances to cite. Something that, there's just too many instances. I think it is, again, it has become such a conflated part of our identity as Black folk. So it's sort of like when we talk about sexual harassment and the Me Too movement and things like that. I find that often we'll be in a discussion like this, and they'll ask each woman to offer a situation, and everyone will struggle to come up with one. But it's not because they haven't experienced it. Every single woman has experienced sexual harassment or intimidation, and perhaps is even a survivor of sexual violence, but struggled to articulate that because it was such an accepted and conflated part of our experience as women navigating the world. And these sort of, overt hostilities, microaggressions, it's harder for me to unpack and to enumerate that, but it's real, and it's there. I would say that, when I talk about, government and systems and healthcare and all the ways in which trust has been violated and breached, it's like why when we talk about voting, I always say that I think people don't vote not because they're ignorant or apathetic and don't know any better. They don't vote not because they don't know enough. They don't vote because usually they know too much. And that too much has been informed by their lived experience. And it's littered with broken promises. And so, whether you're talking about the ways in which the medical community violated trust, whether you're talking about the ways in which my trust was violated early on as a survivor of childhood sexual abuse and later campus sexual assault, and where I felt, institutions in my community, failed me, or whether you're talking about government not meeting the scale and scope of the hurt that families are experiencing in the midst of this pandemic, I feel a huge responsibility to do everything that I can to restore that trust in community, in institutions, and in people. And I will say that in this unprecedented time of hurt, I have been so inspired by the collective care and mutual aid that has emerged, out of community, where people have really understood that we are one human family and have taken care of one another. And I want that to continue. Government needs to do it first, and then, whatever community offers, should be reinforcement. But right now, government and community have been standing in the gap because of the failure of this current administration.
To do it. I have a question that's from one of our viewers that kind of goes along with this. With all that we've been talking about, what could medical personnel, government officials, what can they do right now to build trust? And this is to all of you. Colleen, you want to take a shot at that, or?
Yeah, I'm sadly going to say something that I have to say. In all the trips I've made, as I said, as an honor to walk with people, whether it be to mental health or to medical care, I couldn't tell you the number of times that I have been in that medical room or in that room helping someone and being with them when either the mental health provider or the medical professional, doctor or nurse, when it came around to talking about diagnosis or something that was going on, the person I'm with is expecting us to talk about trauma. And in almost all times, that medical person looked at the person and says, well, you weren't in a war, you don't have trauma. And then they've started to sometimes talk about the racial experiences they've had and the symptoms that their body goes through, and talking about trauma. They've learned it at our program. And the person says, no, that's not trauma. So again, I'm just stunned at how the education issue. So that would be my response. If we could just help people learn more about what we're talking about. It's not that long ago that people didn't understand racism could cause trauma. So we need to really help people and educate them. And we're happy to help as much as we can.
Reverend Gloria, what would you add to what people can do to build trust, those who represent these systems that we're talking about?
Well, first of all, I think it's important to operate in the space of truth and to acknowledge that these feelings, these things, these experiences that people have are actually real, and that it's not only what happened decades ago with syphilis, again, that these are lived experiences even now. And there are two levels in which I would like to see my colleagues, my healthcare, health clinicians operate. One is, in fact, to address the systemic racism that is the health systemic racism that has existed for generations. So the distrust that people have of the healthcare system, again, it's not their imagination, it is absolutely real. And for healthcare systems to look at their own systems, the extent to which they are in fact racist, and to begin to establish policies and measures to be sure that they are addressing those issues and to which they will be held accountable. And for individuals, I think it's important to do the critical work around implicit bias. We all have our isms, and we want to create a community that recognizes that holds themselves accountable around that. Again, in terms of my personal interaction, when I recognize with many of my colleagues that most of us are not going to be in the position where we can make the kinds of systemic changes that Congressman Pressley can make. Or most of us are not going to operate at the head of hospitals. We can certainly, again, be a part of holding people accountable, but we have the opportunity to redress some of these issues one encounter at a time. So when I, as a clinician, encounter Colleen as an advocate with her patient, I'm going to ask myself, where is my ism here? And how can I begin to make sure that I'm listening, that I respond, that I address the person's need? So it's both the public in terms of the system, but it's also the personal.
Excellent, excellent. Congresswoman, do you have anything to add on that?
Yeah, two quick things, and I could just listen to all of you all day. You're extraordinary teachers, and I learn so much anytime I have the privilege of sharing any space with you. But I just did a convening with the president and CEOs of community health centers, and I was really struck by something that I think could be overlooked, and that is the healing that needs to take place for healthcare providers right now. I mean, you know, I'm looking at our community health centers who have always been overutilized and under-resourced. I'll use them as an example. And again, they do have, you know, very diverse, culturally competent workforces. And they are right now having to have, you know, very robust operations around testing. Now, you know, begin the infrastructure for vaccine distribution, you know, all while still doing their other work of treating chronic disease, you know, addressing, you know, preventative care in order to combat these health disparities. And so they're really, because of pandemic fatigue or because of the ways in which their own households have been impacted by COVID, there is a real staff reduction and shortage that we are going to have to address. And they all said that over and over again. And so I do think there's an opportunity for us, both from a healthcare justice, equity, and racial justice standpoint, to be intentional right now in the diversification of that workforce, because there's going to be a real need and for a long time because of these three things that they're all having to do. Still do prenatal care, vaccinations, preventative care, manage chronic disease, COVID testing, and vaccine distribution. And so we have an opportunity to grow that more diverse, culturally competent, trauma-informed workforce, beginning with medical assistance. And then on the policy front, because you know policy is my love language, and I say that because it's cause hurt, so it can also, you know, be an expression and demonstration of love. I'm going to keep banging the drum on this on two things. Our Equitable Data Collection Act. We would not know the disparities in the COVID response if that legislation authored by myself and Senator Warren had not been passed. So it's an academic wonky thing, but data matters. Data tells the story. And so we can have these anecdotal assumptions, but when the data confirms it, that then becomes our guide for the marshaling the direction of resources. And that did pass. Tenets of that were included. The reason there is a congressional mandate right now to collect racial data, and when you read those numbers and you're like, wow, what a disparate impact, is because of the legislation that we passed. So I want to offer that we wrote and was passed. And now I'm trying to get our our Anti-Racism and Public Health Act passed, because what that is going to do is acknowledge the structural limits on access to affordable, high quality care, and how comprehensive research on public health impacts of structural racism can help us to confront and actively dismantle. So it's about the research and the data, and then declaring racism a public health crisis, both as evidenced by those examples I gave at the top. Third leading cause of death for Black Americans is coronavirus. And sixth leading cause of death amongst Black men is police brutality. So racism is a public health crisis.
Absolutely. And Congresswoman, just as you have mentioned the medical community, I thank you, because you guys are all working under pressure, all of you in Congress, and we know that. So I just want to publicly say to thank you. And
we're all your front line. Everybody on this Zoom, we're front line, every single person. So thank you.
Thank you all. But listen, let me bring in Reverend Dana Baker, who's been taking some of our questions. Dana, I understand you might have a question for us that you want to share, because we're almost at the end. I can't believe this hour is almost over.
Yeah, I do. And actually, Congressman Pressley, you set me up perfectly, because one of the questions that was asked earlier on in the evening, when all of you were talking about the different disparities, both in the health community and housing and all these different things, and how often one of the biggest problems was that trauma is not recognized as impacting those relationships. So a couple of our participants actually asked about the intersection of mental health and policing. That's been a big topic. And we know that some of the most difficult tragedies that have happened have been where Black men were mentally ill and they were not handled well. And so so can you talk about policy things that are being talked about in order to, help that mental health intersection with policing work better?
Sure. Well, look, I just want to acknowledge this. Our first responders, they have a role to play in society, but they needn't play a role in every part of society. And they don't want to. When you see that over the last 2 decades that we have grown our school police by a $1 billion investment, and we now have 46,000 school police, but we have not every child having equitable access to a school nurse, a social worker, and a guidance counselor, that is a problem. When we are deploying, instead of mental health clinicians, and trained experts to the home of someone who is living with mental illness or having what the police characterize as an EDP, an emotionally disturbed person. That's how they characterize it. We should not be deploying the police. So again, the first responder has a role to play in society, but not in every part of society, and they don't want to play it. In our schools, we should be making the investment in school nurse, in social workers, in guidance counselors, in those social emotional supports, in restorative justice practices, in trauma-informed training, not because I say so, but because the young people say so, and the data bears out that that best supports them in their social emotional well-being, but also in their readiness to learn. And then when I was on the Boston City Council, and I know that this was work that continued after I left by Councilor Anissa Sabi George, we made great strides in the budget, allocating enough funding for whenever police do a ride along or a sent to the home of someone who is in mental health distress, that they are doing that, they are going to that home with a clinician, with a mental health clinician or social worker. So that's an example of when I say, look, I appreciate the cultural affirmation that Black Lives Matter in the form of hashtags and retweets, and the allyship of t-shirts that you probably didn't even buy from a Black business. But what really matters right now are policies and budgets. And so that is one example on the Boston City Council where funds were directed to support a mental health clinician being deployed to a home instead of an officer. And now on the federal level, I have that legislation that we are advancing to do the very same thing. And that's in partnership with my colleague, Katie Porter. So yes, those conversations are happening. I'll have my aide drop into the Q&A so you guys can pick up the information and share about that bill. And then the other bill that I've introduced for our schools is counseling, not criminalization.
Dana, I think you have another question real quick because we're running out of time, but what's your second question?
Yeah, sorry, just a real quick one because it follows up on that. Another question, Nikki asks that, you're talking about like funded clinician models, but she asks actually about peer support models, given that, there just aren't enough clinicians and stuff out. And I know that's a core of what the Cory Johnson program is. Is there a way that government or, others can really create a more robust peer-to-peer model?
Is that for the Congresswoman?
It can be for the Congresswoman, but it could be for you guys, it could be for Colleen, any of you, actually.
If my queen doesn't matter, I just want to enter in here because I think that everything that Ayanna is doing, I'm her biggest fan. So whenever she has a bill, I say pass it. But here's some things that you can do. Churches can get more involved in this issue. Community centers can get more. Individuals can get more involved. These are our mothers, our brothers, our cousins. What we're doing at the Cory Johnson program is to train our neighbors. Now, we're not going to be all like Colleen. We're not all going to be mental health advocates or clinicians, but we can certainly learn enough and empower ourselves enough to at least identify what trauma is, what stress is, how we can better take care of ourselves. And so I challenge churches, especially churches, because Colleen, don't you say that ultimately this is a spiritual problem? I want you to just tell our viewers how you look at this as a clinician on the issue of trauma.
In fact, I really believe you, and we in the program say this, you cannot talk about trauma without talking about it as a spiritual healing process. Because if you look at the worst three symptoms of trauma and what our neighbors are going through all the time, after they don't feel safe and then they lose their sense of trust and they start disconnecting with folks and feel isolated, they lose their sense of meaning in the world and their connection to either higher power, God, or other people. And that loss of meaning is what really you hear people say disorients them the most. So healing must involve that new sense of meaning, which is an absolute spiritual concept. And you're absolutely right. Our program is peer-to-peer. It is teaching and training our community companions to be with people to do exactly some of what I was just talking about. We have a community trauma healing specialist in Shondell who goes and does exactly these appointments with people and school issues and help in the legal system. It's neighbors, it's people who've experienced trauma who can be trained in this. Churches can do this, People can do this. In our mental health clinician piece, the role that I have is only probably 20% of what we do. It's really the entire community coming together to walk with other people. I mean,
Colleen, I do want to just add to that and say that, you know, so when I'm championing policy, it's not just about the policy, it's about the power of the purse and what sort of practices that incentivizes, right? And so because of the work that we've done together, I'm very proud. My proudest accomplishment in my freshman tenure, actually, and there are many things that I'm proud of, but it's that I convened the first congressional hearing on childhood trauma. That's directly born out of the work that we did together in community. And then coming out of that, I did introduce a childhood trauma bill called the Strong Support for Children Act. And it calls specifically for investing in grassroots community-based organizations that are doing what you are doing to build that resiliency. Because I've seen up close and personal, you all heard me talking about the CHCs being utilized and under-resourced. That is the church. You all are doing everything. You are providing the mental health. You are standing in the gap of food insecurity, of, you know, housing insecurity, of all of these things. And then doing this intentional work of healing and mitigating trauma and treating it. And you deserve to be invested in. And I don't think that enough of the federal funds are getting to models like your own. So that is a part of every bill that I introduce on trauma.
I thank you, Congresswoman, that you made it, and you are a very busy woman, but we certainly are glad that you made some time to talk with us and to talk to the community. You are doing the work, there's no doubt. I mean, we're not even concerned about that. We know you're doing the work, so you tell us what we need to do to support you. But we thank you for being on this program. Gloria White-Hammond, you are just my sister, my shiro, and I thank you for being on this journey with me. Colleen Sharka, you are always there, and we are doing our work. So we challenge all of you who are watching us that there's been a lot of things said here tonight, and we have to support the people who are on the front line, be they our congresswomen or our doctors or our EMTs. We have to, or our police. We have to support each other and our families and our neighborhood. But we're all in this together. You hear that all the time, but it is so true. Reverend Gloria, Congresswoman Pressley, Colleen Sharka, thanks for joining us. Thank you all for joining us, and keep up. We're going to keep up with you and try to keep these conversations going. Be safe. Good night.
Good night, everyone.
Thank you, Reverend Liz.
Thank
you, everyone.
Thank you.